It is a disease that affects 10% of the U.S. population, or about 17 million people. Children miss 10 million school days a year because of it, making it the leading cause of school absenteeism. More than $6 billion a year is spent for treatment and research, and yet the number of people who suffer from this disease continue to grow. In fact, in the last 20 years, the number of people affected has nearly doubled. I am talking about asthma. If you do not have asthma and you wonder what it's like to have an asthma attack, imagine trying to breathe through a straw with your nose pinched shut and someone sitting on your chest. The harder you try to breathe, the harder it is to breathe. I think you should be interested in this topic because even if you have gone through your whole life without any hint of the disease, there are people in their 30s, 40s, and older who have suddenly developed asthma. My name is Kayla Hambrick, and I was diagnosed with asthma when I was a baby, and I still suffer from it today. Throughout my childhood and teen years, I frequently had to be taken to the hospital emergency room when my attacks couldn't be controlled by my medication. Now I realize that the seemingly harmless things that we live with on a daily basis can affect an asthmatic's life. This evening, I will be speaking about what asthma is, what triggers an asthma attack, and what can be done to treat and prevent this disease. Asthma is a respiratory disease that targets the lungs, triggering inflammation along the airways, causing attacks of wheezing, shortness of breath, chest tightness, and coughing. The two main causes are airway constriction and inflammation, and together they narrow the airways, and that's usually when an asthma attack occurs. The muscles surrounding the airways become tight, and the lining of the air passages swell, which reduces the amount of air that can pass by. Genetics and environmental allergies are other factors that can cause attacks. Studies show that a person with just one parent that has asthma is 2 times more likely to have it. In many allergy-sensitive people, asthma symptoms can be triggered by breathing an allergy-causing substances called allergens or triggers. A few common asthma triggers include pet hair or dander from animals, dust, changes in weather, more often cold weather, exercise like running and aerobics, mold, pollen, respiratory infections like the common cold, and tobacco smoke. During an attack, the muscle surrounding the airway tightens, which causes wheezing as air passes through the narrowed airways. The lining of the airways becomes swollen, and the mucus glands among the airways increase mucus production, which causes coughing because the lungs are trying to dislodge the mucus, and difficulty breathing because the airway is smaller and filled with mucus. The avoidance of all possible asthma triggers can be difficult, and even if one asthmatic person is able to tolerate one trigger, encountering a combination of them can have an asthmatic suddenly gasping for air. That is why treatment and prevention are so important in keeping asthma under control. An allergist or immunologist specializes in diagnosis and treatment of allergic diseases like asthma. An immunology physicians complete medical school, a residency program, and then spend 2 years in training, learning about the prevention, diagnosis, and treatment of immune system problems such as asthma and allergies. Many people with asthma need to take long-term medications on a daily basis, even when symptoms are not present. Common medications include corticosteroid inhalers, long-acting beta-agonists, and theophylline bronchodilator in pill form. The most common medication types are combination inhalers, which combine the corticosteroid inhalers and long-acting beta-agonists, such as Advair and Symbicort. You've probably heard of them. Studies are now being done to show that foods rich in antioxidants, such as fresh fruits and vegetables, can help protect the lungs from oxidative stress, which can then decrease the risk of asthma. In conclusion, it would seem that asthma is a disease that is more out of control than ever before. And in fact, statistics do show that the number of asthma sufferers has risen dramatically in the last 20 years, as has the number of deaths because of it. Medical experts speculate that the increase is due to environmental changes and more sedentary enclosed lifestyles. But advances in testing and treatment have improved the quality of life for asthmatics as long as they are able to take advantage of the technology available. Unfortunately, the greatest percent increase in people with asthma is the populations living in poor or inner city areas, typically the people with the least access to quality health care. One bright spot of the disease that about half of all people with asthma see major improvements or a total absence of symptoms in later teen years. However, the underlying cause of the disease, whatever it may be, remains, and under the right circumstances, it can return. Thank you.